Thank you, Mr. Chairman. And I don't want to take up too much time, but I would just point out to the ranking member of the full committee that the Democrats did have an entire year with which to come up with their budget and their appropriations, and it's only because they failed to do their work that we're doing the CR right now. Let me direct your attention once again. I know Chairman
The House
Pitts,
passed it, the Senate
Chairman
Republicans
Pitts,
stopped it.
Just the time, reclaiming my time. Chairman Pitts referenced Judge Vinson's ruling in Florida from earlier in February, and I sent you a letter on February 10th asking you about the implementation plans of HHS, to which I have not yet received an answer. My concern is Judge Vinson, in his ruling, said that a declaratory judgment is the functional equivalent of an injunction, and he went on to say that officials of the executive branch will adhere to the law as declared by the court. As a result, the declaratory judgment is the functional equivalent. The declaratory judgment is the functional equivalent of an injunction. There is no reason to conclude that this presumption should not apply here. You apparently feel differently, and we heard from our governors earlier this week that they are, in fact, feel like they're on, I think Governor Herbert said, shifting sands. You feel that ultimately the individual mandate will be upheld as constitutional by the Supreme Court. Judge Vinson felt otherwise. We are in a period where I wish we could accelerate or expedite the Supreme Court, but apparently I don't get my wish. The Supreme Court will likely rule in June of 2012, and that is a long time for the states to look at this and wonder, which direction do we go? You could certainly provide some guidance and some help by saying, we're going to look seriously at what Judge Vinson said. So I still await a response from your letter, but could you briefly give me some comfort that you're going to comply with the judge's order?
Congressman, I think it's far from clear what Judge Vinson's order indicates. So the Justice Department has gone back to the judge to ask him for a clarification of his order.
Yeah, reclaiming my time. Again, I think he stated it as clearly as he could. He is going to restate that, and I look forward to his decision as well. But honestly, the decision of a member of the executive branch not to adhere to the directive of the court is, I think, troubling.
Did not file an injunction, as you know, which is the standard procedure and we've asked him to clarify and look forward to his ruling.
Governors all across this country right now, including my state of Texas, and I know Attorney General Greg Abbott is very concerned about what do we do now, because we don't know.
There isn't anything now that is being done with the individual
I look forward to your written response to the letter I sent you a month ago, and I hope that you will provide that for us. We've heard some of the questions have already centered around some of the issues of mandatory funding within the law that was signed last year. And I'm particularly concerned about Section 4101, both A and B. 4101A provides mandatory spending for the construction and only the construction of school clinics. 4101B creates new discretionary funding for paying the doctors and nurses who are going to work in those school clinics. So I guess the question is, why is the construction mandatory and paying the staff discretionary?
That's the way the bill was constructed by members of Congress.
By members of the Senate Finance Committee staff. And to take up on where Chairman Upton was talking just a moment ago, I would draw your attention in the law to Section 1311. It's on page 78 of my copy of the law, where under enhancing patient safety, beginning on January 1, 2015, a qualified health plan may contract with, Part B, a healthcare provider only if such provider implements such mechanisms to improve healthcare quality as the Secretary may by regulation require. I mean, that's pretty specific too. So where are you going with this? What have you directed your staff to look at? I mean, again, providers all over the country are asking me, what does this mean for us? Well, again, perhaps I could get that response in writing. But, I think, look, we switched sides here in January. And the reason we switched sides was because of this law. It is precisely because of this type of language in this law that the American people looked at this and rejected the notion of what was forced upon them last year. There is unprecedented power now that goes to your office, unprecedented spending that goes to your office. These are decisions that are made exclusively by the Secretary of Health and Human Services. At no other time in our history has so much power gone to one federal agency. Can you understand why the American people are understandably concerned by what has happened to them?
Congressman, I think that the American public should be alarmed if we are paying taxpayer dollars to any provider or a hospital bed of over 50 which doesn't have a quality system in place.
But quality determined by the Secretary. Quality determined by the Secretary, and no other, no right of appeal, no secondary motion may be made, only by the Secretary. That's
would
what's
be in the
offensive.
CMS guidelines in terms of payments for Medicare pays that when that rule is promulgated, there'll be plenty of public input. But again, I think it would be alarming if we paid taxpayer dollars without
I just add that 10 rules
measurement.
have gone without public comment. 10 rules have gone into
Gentleman's time has
action.
expired. Yield.